Good morning, everybody. Thank you very much for joining us. This will be a technical meeting on the impact of COVID-19 on cervical cancer screening and treatment and vaccination. So a few words on the HPV Prevention and Control Board. Our mission is to generate, multiply, and disseminate relevant information on HPV to a broad area of stakeholders, and thereby contributing to the control of HPV infection and to the prevention and screening of HPV-related cancers. So the objectives are to provide evidence-based guidance on key technical and strategic issues and to monitor the progress of HPV control programs at country and regional levels. So we are a multidisciplinary group of prominent experts. We have advisors and observers. Each person acts in their personal capacity and are not representing directly, therefore, their institution. They're often affiliated with stakeholder partners, and we have open and honest discussions. It's important to notice that advisors and speakers of our board and attenders of our meetings are not paid. We do not have a formal organization, which allows us to be quite flexible with minimal bureaucratic structure. And we also have observers that serve at national and international organizations. You will find a list of all these people at our website, so during time I'm not going to go over them, and I know that most of them will be joining us in the following hours and days. So this is the Secretariat here at the University of Antwerp. They will also introduce themselves shortly after this presentation. So it's important to know that we are located at the Center for Evaluation of Vaccination at the University of Antwerp. And in total, in average, we spend 2 full-time equivalents of these people to the tasks we have with the HPV Prevention and Control Board. What we do as a secretariat, we prepare and organize the meetings. We make sure that there are scientific publications based on the outcome of the meetings. We also are active in the media. We have a website. We participate in third-party meetings, and we do receive funding from industry, which are listed on our website. But it's important to know, as I said, that nobody of our advisors or speakers are paid, and these funds are used to organize our activities. I think the in-kind support of all the members who are joining us is much higher than the financial contribution from industry. And important to know that all issues are handled according to the rules of our university. So this is an example of the website where you can find all the meetings, all the details on who we are, how we work. And important, since a number of years, we do not only have the slides of our meetings on our website, but also the videos if the speakers approved that this is made public. So it's a quite resourceful website in the meantime, where you can find a lot of material. Just before handing over to Karen, this is, I think you all received a background document. So we do, for each meeting, do a literature search on the topic. It's obvious that in this case, our findings were limited. But I think it's interesting to see that for the different sessions, you can find what has already been published. We specifically also looked for available guidelines that have been adopted since COVID. And in addition to that, you can find the biography of the different speakers. We are still completing this document, and it will be finalized after the meeting. So, but we do encourage all the speakers to send us their details so that we can complete this document. And I would like to hand over to my co-chair, Karen Canfell.
Thank you very much, Alex, and thank you very much to the HPV Prevention and Control Board. So my name is Karen Canfell. I'm an epidemiologist and modeller from Cancer Council and the University of Sydney in Australia. And I'm here in my capacity as one of the organisers of the COVID-19 and Cancer Global Modelling Consortium. And I'd like to acknowledge the co-chair of the steering committee who's here today, Freddie Bray. So the CCGMC is a consortium that's come together with the aim of informing our governments and decision makers during and in the recovery phase of the crisis across cancer control issues. So we have a very broad remit from cancer prevention, primary prevention, to screening and early detection, and to cancer treatment and outcomes. And we're considering these issues across a range of cancer types. So we've brought together over the last 7 months over 260 researchers from 38 countries and over 160 institutions, and we're really pleased to be supported importantly by the team at the International Agency for Research on Cancer, UICC, the Canadian Partnership Against Cancer, Cancer Council, and the International Cancer Screening Network. Next slide, please, Alex. So the questions driving the CCGMC activities are relevant to all cancers, but they really, I think, underpin many of the issues that will be discussed on the agenda for this meeting. Firstly, our aims are around quantifying the impact of the long-term aspects of the crisis on cancer outcomes, and really trying to use this quantification exercise to supplement our understanding of the full health impacts of the crisis, not just the acute impacts, considering all disease outcomes, not just infectious disease outcomes. And of course, the impact of non-pharmaceutical interventions and lockdowns on things like cancer risk-related behaviour, cancer screening behaviour disruptions, and cancer treatment disruptions. Of course, we're then mostly interested in moving on to looking at optimal mitigation and recovery strategies after disruption. In the context of cervical cancer, this could include, for example, issues around how finite resources should be prioritised as services reboot after disruptions, for example, in the context of limited colposcopy of treatment services capacity. And finally, in respect to the potential silver lining, what's the potential impact and cost effectiveness of the accelerated adoption of innovative recovery strategies or new technologies? Next slide, please, Alex. So I'm now going to move to the aims of this meeting, and we're really pleased to say that I think it will help inform the activities of the cervical cancer working group for the CCGMC. And I'd like to acknowledge all of the members who are here, who are presenting through the meeting, and just really point, I think, to some of the discussions that we'll be having through today and into tomorrow that will help formulate the research and questions that are important for the CCGMC going forward. Next slide, please, Alex. So I'll just run through the meeting objectives. Today, we'll be covering a range of issues. Firstly, an update on the pandemic, what's the new normal? Secondly, discussing the impact of COVID-19 on the WHO cervical cancer elimination goals. And then moving specifically to the topic of vaccination, looking at the current situation for vaccination programs across different regions in the world, discussing the impact of COVID-19 on school-based vaccination programs and strategies to restart programs, vaccine implementation and disruptions in LMICs and coverage in high-income countries, the impact of COVID-19 on vaccine clinical trials, most importantly, of course, the one-dose ongoing trials, given their importance to policy setting going forward, with country examples, ongoing trials, ongoing challenges and strategies to move forward. And also we'll be discussing how the pre-pandemic issues with vaccine supply might evolve due to the pandemic. Secondly, in respect to the meeting objectives, we'll be looking at the impact of COVID-19 on HPV screening and treatment. We'll discuss the current situation for screening and treatment programs across different regions of the world. We'll look at successful programs such as the well-known ROSE project in Malaysia and discuss how COVID has impacted such programs, how they've adapted, and what the way forward might be. We'll of course be talking particularly about HPV self-sampling as an alternative strategy and an accelerated strategy for dealing with the crisis. We'll look at strategies to restart screening and treatment in both high-income countries and LMICs. We'll discuss the incredibly important issue of the supply shortage of HPV assays and reagents in the context of the competing requirements of COVID testing. And we'll look at HPV assay validation in COVID-19 times, current prospects and challenges. We'll look at the impact of COVID-19 on HPV screening and treatment clinical trials with country examples of ongoing trials, their challenges and strategies to move forward. And we'll be discussing modelling as a tool and strategy to support decision-making, thinking about what the information needs might be for developing robust and accurate models of pandemic impact. And of course, reviewing cervical cancer control disruptions in various countries and assessing the impact of COVID-19 on vaccination, screening and treatment. Finally, tomorrow we'll be going more specifically to modelling with a session run by the CCGMC, which will discuss modelling strategies to support decision-making. We'll look at some preliminary results from the consortium. We'll discuss how we can use modelling expertise to determine the intermediate and long-term impact of disruptions and how it can inform decision-making for optimising mitigation and recovery. And then in the final session of the meeting tomorrow, we'll be talking specifically about how we can turn the impact of COVID-19 into a positive pathway for innovation, discussing how COVID-19 can be used as an opportunity to bring more robust techniques to deal with screening and vaccination challenges. For example, mobile clinics, self-sampling, mobile apps, and more innovative approaches generally. So thank you very much, Alex. I'll hand back to you to introduce the participants.